Hi everyone, my name is Brina. I'm going to be starting off the 2022 table clinic on who brushes your teeth when you can't. We have Emily as our team lead this year, Leona, Victoria, and Kennedy joining as well. And we have the amazing Christian Hulk who has been our mentor. Who brushes your teeth when you can't? Welcome to our presentation. In this presentation, we're going to discuss the oral care and long-term care facilities and who provides it. We want to discuss what with you it looks like for people with prosthodontics along with the medications that are frequently used in the older population, looking at the programs in Canada and comparing them to different provinces. Let's talk about long-term care facilities in Canada and Nova Scotia. In Canada, there are around 2,076 long-term care homes, and in Nova Scotia, there's about 7,500 people in long-term care facilities. That's more than 21% of Nova Scotia's population over the age of 65 living in long-term care. Nova Scotia alone is the third highest percentage in the country. Canada's senior population. Over the past 40 years, the senior population has tripled from 1977. In the next 20 years, Canada's senior population is to grow from the age of 65 by 68%. The population of seniors is expected to grow significantly between 2017 and 2037. Nova Scotia alone will grow 2.1 times. Let's talk about COVID and oral care. In April 2020, the Canadian Armed Forces were called into Ontario's long-term care homes due to the increase of staffing shortages. In doing so, it brought light of the lack of care and the basics that were being missed. There was no oral care products being ordered for the residents. Food was being left in the patient's mouths while they slept as well. All these may sound like a negative, however, it shone a bright light on how we need to continue to have oral care in long-term care facilities. Universal oral care plans. Canada actually does not have an oral care plan in long-term care facilities, leaving the provinces and territories to create and maintain their own programs. This may be one of the reasons that 72% of seniors over the age of 65 have moderate to severe periodontal disease.
Universal oral care plans. Canada does not currently have a universal care plan for long-term care facilities, leaving each province and territory to create and maintain their own programs. Given the amount of private for profit, private for nonprofit, and provincially funded facilities, this may seem understandable, but not acceptable. This may be one of the reasons that 52% of our seniors over 65 have moderate to severe periodontal disease. Now, a universal care program was set in place to assist with preventative care for our children up to the age of 15 in Nova Scotia. This was a program to save oral health and later costs associated. After reviewing the federal and provincial programs and seeing the lack of care currently being provided, a provincial and federal program would greatly benefit seniors by having a universal oral care for those 65 and over. It would be a limited care program aimed at maintaining and the upkeep of good oral care. Not only would this prevent poor oral health, but it would also assist in lowering residual illnesses caused or associated by oral bacteria. In 2012, JCDA did a survey in Nova Scotia of healthcare facilities. 48 residential facilities took part in this survey. Out of the 335 adults, only 25% reported having regular dental care. 76 described their oral health as good or excellent. 41 were odontulous or toothless. 41% had some mucosal abnormalities. 36 reported xerostomia, and 25 had perceived or self-reported dental conditions. Now, Dalhousie University has set up a program called Brushing Up on Mouth Care, and it can be found at brushingup.ca. This program outlines the standards of care that is required by long-term health care facilities within Nova Scotia. It is a detailed set of guidelines that, if followed, would greatly benefit the seniors in those care homes. It has also detailed all of the difficulties associated with senior care. Nova Scotia has a long-term care program that requires an oral assessment to be completed within 2 weeks of every senior's placement to a care home. as well as daily mouth care. They should be reassessed each calendar year, and all changes should be noted in the patient's chart daily and yearly. In Nova Scotia, there are two groups of seniors when it comes to dental care. There are well elders who live at home or with family and are still able to continue care with their private dentist, and there are seniors in long-term care homes. Well elders usually have private insurance and better access to regularly scheduled visits, while seniors in group homes rely on their caregivers to determine when they need to be seen by the visiting oral care provider or go out to the dental office. Some of the concerns with dentition in the elderly are dry mouth often occurs because of medications, medical treatments, and conditions such as diabetes and stroke. This can lead to problems tasting, chewing, and swallowing, gum disease, tooth decay, and thrush. Recession can be caused from a lifetime of brushing. However, gum disease is the most common cause of gum recession. This can lead to tooth sensitivity, increased risk for infection, and bone loss. Gum disease can be caused by diabetes, genetics, hormonal changes, and medications that reduce saliva production. This can increase the risk of heart disease, stroke, and bone loss again. Oral cancers also can occur from poor dental and oral hygiene, medicines that weaken the immune system, and the rubbing of teeth and dentures over a long period of time.
Medications that affect oral health. For dry mouth, it's Alzheimer's medication, inhalers, antihistamines, Parkinson's medication, gum swelling or overgrowth, epilepsy medication, blood pressure medications, as well as long-term use of sweetened medications can lead to tooth decay. Some stats. In Canada, a survey took place in Ottawa, Ontario on outpatient medication and the use implications for dental care. There were 322 patients enrolled in the survey. The median age of these patients was 52, and for prescription medications alone, the average was 2.2 prescriptions per patient. Recent data from the Canadian Institute for Health Information shows that almost 2/3, which is 62% of Canadians aged 65 and older, are using 5 or more classes of prescription drugs. Also in this study, they found that approximately 35% of patients were taking an antihypersensitive medication. The common use of blood pressure control medication has significant implications for dental care. Some more stats. In a study done in Belgium, associations that were made between medications taken and oral health. The higher number of medications taken, the less natural teeth one would have. The lower number of medications taken, the more natural teeth one would have. The more medications taken, the more caries or potential caries a resident would have. And seeing the stats and the clear link between medications and oral health, does this need to be taken more seriously? Change in the medications or what causes these side effects? Keeping teeth longer. With proper oral hygiene, seniors are keeping their natural teeth longer. With a healthy mouth, quality of life and overall health increases, especially for those in long-term care facilities. Maintaining an adequate standard of care. Assuring that our already at-risk population has the means to proper oral hygiene is crucial in maintaining an adequate standard of care. If oral hygiene is maintained by staff in long-term care facilities, seniors should be able to keep their natural teeth longer. Steps that should be taken are daily brushing and flossing, fluoride rinses, increased dental hygiene visits. Partial dentures should be cleaned regularly and thoroughly. Residents should be screened for oral cancer, and all prosthodontics should be checked for fit and comfort regularly.
Who brushes your teeth when you can't? In short, currently the answer is the continuing care assistants. Just recently, according to the Nova Scotia Premier's office, the province is investigating approximately $65 million in health authorities, long-term care, and home care. Effective on February 10th, 2022, the province increased wages of unionized and non-unionized CCAs at all levels in the publicly funded sector by approximately 23%. This increase will make the Nova Scotia CCAs the highest paid in Atlantic Canada. The facts. In Nova Scotia, there are 6,700 publicly funded CCA positions. Most of them are in continuing care facilities. Majority of CCAs have an expired collective agreement, October 31st, 2020. Their expired annual salary range was $36,529 to $39,443. The new salary range is between $44,660 and $48,419. That's approximately a $9,000 increase per year, meaning they went from an hourly rate of $18.93 to 2019 to an hourly rate of $23.27 to $24.83. CUPE Nova Scotia President Nan McFadden said, while it brings them closer to where they want to be, the union intends to continue bargaining. Not just a wage increase. Many CCAs work short-staffed and under difficult conditions. This has affected the quality and availability of care for seniors and their families. With the wage increase, they are also trying to ensure a 4-to-1 ratio, meaning 4 hours of care per resident instead of 2.45 hours. With the increase of their yearly wage, they want to recruit and retain more CCAs. The government has committed to hiring 1,400 additional CCAs, and they hope that the increase has a positive effect on the healthcare sector, specifically its nurses, by elevating the strain on the resources. How will this affect oral care and long-term care facilities? Moving forward, and considering the changes that are in effect, the hope is that we can recruit more CCAs to lessen the workload and scheduling issues for current CCAs, thus being able to give each resident the attention they need, whether that means helping them get booked for cleanings or other procedures, or more everyday things like brushing and flossing on a regular basis, which will lead to a lot of oral care and their health. You may be asking, where are the RDAs? Throughout our presentation, we have focused on what is currently in place, which as of now has the CCAs taking care of the assessments and daily oral care requirements. While the CCAs have their own scope of practice, it is not as detailed as that of a certified, accredited RDA. Looking forward in our presentation, we will be seeing a few different statements and programs that may see oral health care in long-term facilities in a whole new light.
CDAA position statement on OHC standards for long-term care facilities. The statement was approved by CDAA Board of Directors on January 25th, 2017. The statement was reviewed, revised, and approved by the CDAA Board of Directors on September 9th, 2021. The CDAA statement breakdown. What would this mean to our industry, you ask? Well, as we previously mentioned, there are a total of 2,079 long-term care facilities. Each facility would be required to have a full-time specialized RDA to perform oral care intake assessments and to make sure that the daily oral care needs were being met. The RDA would ensure a nationally standardized program was being met, adhered to, and was applied universally to all residents of those facilities. Ensure all patients' information was shared appropriately to the correct oral care practitioner, medical practitioner, or faculty staff. The CDAA supports the implementation of a continuing education program to make sure staff, residents, and family members are aware of the implications of good oral care and overall health. We did have some breaking news as of March 23rd, 2022. Liberal/NDP government proposed a national low-income dental program. So what does this mean for our seniors in particular? Laura Tamblin-Watts, founder and CEO of the senior advocacy group CanAge, said the program would make a huge difference in the lives of seniors who don't have coverage and can't afford dental care. Older adults desperately need the access to dental care that right now we don't have consistency across this country, she said. Watts said Canadian seniors without dental coverage often turn to hospital emergency rooms when experiencing dental issues. We know that ERs are overwhelmingly the country's dentist of seniors, and that should not be the case, she said. So nearing the goal, the Liberal/NDP oral care program would be rolled out over 3 years, starting later this year with children under 12. Next would be children under 18, then seniors and people with disabilities in 2023, and to complete the program by 2025. Families who earn less than $70,000 and $90,000 a year would be eligible to have their copays waived. By adding this program, it would be beneficial on the overall healthcare system by reducing the residual illness that requires hospitalization by our seniors. With this in place, Canada would cover its children, seniors, and lower-income citizens, moving closer to a universal oral care program. And these are our references. And thank you guys so much for watching. We hope you enjoyed. Bye.